Good morning. I'm glad there are a lot of people show up for this morning sessions after we had entertainment until midnight yesterday. I've been with NeoSpine, working with Dr. Wong for about over 10 years, and initially was more procedure-based practice. The past 7 years, we have evolved into doing more integrated with chronic pain management practice combined with interventional. So today my talk is really focusing on how to integrate our goal this year, because we added 2 more new surgeons. So it's very important to integrate pain management to support the spine practice. I think it's crucial. Besides, we do a lot of interventional procedures, for conservative therapies, for patients that may not need surgeries, and also even for patients after surgery, if they still need some pain management, that's what we're going to support them. And it's important that for a practice to flow smoothly, because the surgeon also ordered the injections. And so I think it's important that everybody understand the medical guidelines and required documentations prior to order any kind of interventional procedure. So it's important that, I think for our practice, to everybody on the same page, know all the insurance guidelines to get approval quickly, because what we're experiencing is more denials because they have a lot of prior auth even for procedures. So if everybody's on board ordering the right injection with the right diagnosis code is critical. And also, I do a lot of kind of like trigger point injections. A lot of patients, they might come in with very regionalized pain, sometimes can tease out their pathology by make sure it's not a myofascial pain. So that's something during the consult, even my mid-levels, we can do it right away. Even with the first consult, if you feel like they do have some myofascial components, we will do some trigger points injection to kind of rule out some other myofascial pain issues, or even cervicogenic headaches. Another important aspect of pain management, I think is critical, is the perioperative management. We do have more chronic pain patients with opioid crisis. There's a lot of patients, unfortunately, they're still on pain medications. About probably in our practice, about 20% of surgical patients, maybe 15 to 20% of patient that will be on pain medication even prior to surgery. Some of them even greater than 60 morphine equivalents. So what do we do with these patients? Because I think there are a lot of data supporting if the less opioids they're on prior to surgery, it's better outcome. And also we want to avoid them to have more, become addicted to pain medications after a surgery too. So perioperative management is critical to have set up protocols, wean them down, having a consult to our department before surgery when patients are on higher dose of narcotics. Also, we screen patient out for they require behavioral health. I think that's one thing sometimes we forget to screen them out and they need the help on. So this is mainly I'm an anesthesia background, so it's important that we want to work with the surgeons. We're not trying to cancel surgery or try to to avoid working with them, and we want the patient to have the best care. Okay. Another thing I want to talk about is working with Dr. Wong for the past 10 years. I think we generate a lot of discogram data that with lumbar fusion. I think that's something. My goal is hopefully we can have more collections of that, because I think we have pretty good results. And also I was talking to Dr. Lee. He thought it was very helpful, even for working in Maldives, working up some patients. I think, with technologies, we always can see the great images on the MRI, but some patients with multiple degenerative disc disease, it's still not clear about where exactly their back pain is coming from. I think that's when the discogram evaluation is still critical, and we do incorporate that in our practice. So how do NeoSpine surgeons utilize discogram? So there's some examples. So for some people that with spondy, you already know the spondy level, but you want to see the level above or below, may still have degeneration. You want to see that's potential source pain, and I think those patients we can do a discogram prior to decide on the final surgery.
Hey guys, thanks for watching. To continue, please log in or create an account for free. Thank you for your support.